Vinyl chloride, a risk assessment report by Amna Sandhu. Introduction to vinyl chloride. Vinyl chloride is used to manufacture several products regularly used by humans. The most common products are pipes, plastics, wire cables, furniture, and automobile parts and upholstery. This compound has a chemical formula of CH3Cl. It's a colorless gas that can, under specific circumstances, form peroxides in a spontaneous explosive polymerization process. Vinyl chloride has been classified by the EPA as a Group A human carcinogen. More about vinyl chloride. Vinyl chloride decomposes on burning to produce toxic and corrosive fumes, including hydrogen chloride and phosgene. Vinyl chloride and related products are non-biodegradable. Exposure can occur through inhalation, ingestion, or evaporation. Vinyl chloride usually exists in a highly flammable pressurized liquid form. Short-term exposure to high levels of vinyl chloride results in negative central nervous system effects such as dizziness, headaches, and drowsiness. Long-term exposure through inhalation and oral ingestion results in liver damage. Exposure from inhalation can occur from exhaust gases coming from factories that produce vinyl chloride. Usually the air inside newer cars contains higher levels of vinyl chloride from the new plastic parts. Exposure from evaporation can occur from fumes coming from stores or buildings where the chemical is kept. Exposure from oral ingestion can occur from drinking water that may contain vinyl chloride in cases where the piping system uses PVC pipes. Dose-response relationship. The Environmental Protection Agency has established a maximum daily exposure at 0.1 milligrams per cubic meter reference concentration and 0.003 milligrams per kilogram reference daily dose of vinyl chloride. Acute and chronic exposure. Acute exposure, largely from inhalation, affects the central nervous system and causes vertigo. Acute exposure also irritates the eyes, respiratory tract, and kidneys, results in loss of consciousness, inhibition of blood clotting, and cardiac arrhythmias. Chronic exposure is associated with joint and muscle pain and scleroderma. Central nervous system effects include sleep, hearing, and visual disturbances, as well as memory loss. Exposure also includes severe liver damage through oral exposure and inhalation. Occupational exposure, for those who work in factories dealing with vinyl chloride, causes finger blanches and numbness upon cold. Developmental and carcinogenic exposure. Developmental and reproductive exposure leads to detrimental effects on male sexual performance. Researchers have associated vinyl chloride exposure to decreased male fertility and testicular damage. Exposure also causes an increased incidence of birth defects, including miscarriages in pregnant women. Studies done on pregnant mice have reported various birth defects and decreased fetal weight. Increased exposure through inhalation has been reported to cause rare forms of liver cancer. According to animal studies, vinyl chloride causes angiosarcoma of the liver. There is an increased incidence of exposure at earlier stages of life rather than after maturity. Does vinyl chloride remain in our bodies forever? In the body, vinyl chloride is efficiently absorbed by inhalation and oral routes, and then quickly converted to water-soluble metabolites that are rapidly excreted. Vinyl chloride can be detected in urine and body tissue samples, but this does not indicate total exposure. Vinyl chloride at a low concentration is excreted in the urine, while higher concentrations are also eliminated through exhalation. Study results report that 42% of vinyl chloride was retained after exposure to concentrations of 60 milligrams per cubic meter. The maximum retention time was 15 minutes, which varied with different individuals and their body types. Research indicates that vinyl chloride and its metabolites do not accumulate in the body. These are my references. Thanks for listening.